San Diego has the highest number of suicides among veterans. What did you find out?
Well, so the latest numbers from the California Department of Public Health are that in 2017, 111 veterans in San Diego County committed suicide. Number 2 is LA County, where 93 veterans killed themselves. And LA still has more veterans than San Diego, so that number is significant. Now, if you drill down a little further, the suicide rate in LA is 30 veterans committed suicide per 100,000 veterans. But the suicide rate in San Diego in 2017 was almost 45 veterans per 100,000 veterans committed suicide. Now, the VA says the national suicide rate for veterans is just under 30 veterans per 100,000, and that's already considered a crisis.
That's a lot. So what's driving these numbers?
So the VA is already alarmed by the rising number of suicides among younger veterans. And San Diego County has a lot of Iraq and Afghan veterans. I asked that question to a lot of experts, though, and the person I really want you to hear is Kathy Schott. She's a retired Air Force officer, and she counsels families who have had someone commit suicide. Her son, Tony, who was an Iraq veteran himself, committed suicide on Christmas Day, 2013.
That's him and his son.
Kathy Schott knew her son, Tony, was having trouble. He was living halfway across the country. He'd had a messy divorce. He was in the middle of a custody battle over his young son, and it wasn't going well.
I know I talked to Tony all the time, but I didn't hear the pain at that point.
She says he went to the VA 2 days before Christmas.
I told him I couldn't make it through the holidays. And I said, "What's going on?" He goes, "Mom, I'm just so sad." And I go, "Buddy, everything's going to be okay. I promise everything will be okay."
He finally returned her call on Christmas 2013, and he sounded optimistic.
When I replay that conversation, and I have many, many times, his very last words to me were, "Mom, don't ever forget how much I love you." I heard it, but I didn't hear it.
Schott emphasized how difficult it can be to tell when someone is about to kill themselves, even if you know that person well. At times, military service can make people even harder to read.
Nobody wants to go and admit, I have a problem, which we need to admit, I have a problem. I'm hoping that it's getting better, but, I think there's still this stigma that if you say you have a problem, you're not fit for military. Yet we all have problems. We all deal with something.
She casts around for some other reasons. Like so many veterans, her son killed himself with his own firearm.
He was constantly teaching others how to use guns safely. And then he used a gun. Among veterans, I can see where firearms are a big thing, Here in Coronado, we have the damn bridge. Sorry, but we have that bridge. Which we need to figure out a way to do something so it's not so accessible.
So Kathy mentions the Coronado Bridge, and lethal means is definitely part of the puzzle. According to the medical examiner's office here in San Diego County, 9 veterans killed themselves by jumping off that bridge between 2013 and 2017. But that's nothing compared to firearms. Among the 474 veterans who killed themselves over that 5-year period in San Diego County, 262 of them used a firearm, which is among the most lethal means.
Now, how hard is it to get good numbers on all this?
Well, Jade, it's actually much harder than you might think. I talked to the San Diego medical examiner, Dr. Stephen Campman, and he says that California's law is about to change just to get better numbers.
The bill requires that the status be recorded on the death certificate by whoever's completing the death certificate, which will that part will be the families and the funeral homes. But then the other part of the bill is that then the state will be able to give that information to the VA.
So the hope is that better data leads to better solutions.
Okay, and this is a series you're following. I know tomorrow you're going to be talking about elderly veterans who commit suicide. Steve Walsh, our military reporter there. Thank you so much, Steve.
Thank you, Jade.